Understanding the effects that distress will have on your 2-year-old. Distressed crying in babies, especially those between the ages of 0 to 2 years, can have a significant impact on their feelings and emotions, physical health, and mental health. It's important to note that babies at this age are still developing their emotional and cognitive function, and their ability to communicate is limited to crying and nonverbal cues. Here's a detailed breakdown of the effects. Feelings and emotions. Fear and anxiety. When your baby is distressed and crying, they often feel fear and anxiety. They may not understand the source of their discomfort, which can lead to heightened feelings of helplessness. Frustration. Babies might become frustrated if their needs are not met promptly. This frustration can manifest as more intense crying and agitation. Attachment and bonding. Distressed crying can serve as an attachment signal. Babies rely on their caregivers to respond to their cries, and a consistent response can help build trust and strengthen the parent child bond. Physical health, sleep disruption. Frequent distress crying can disrupt the baby's sleep pattern, leading to sleep deprivation for both the baby and yourself. Appetite changes. Some babies may experience changes in their feeding pattern when distressed, which can affect their nutrition and growth. Physical stress, persistent crying, can lead to increased physical stress in the form of elevated heart rate, blood pressure, and stress hormones. This can be detrimental to the baby's overall health if it occurs frequently. Mental health, stress, and overstimulation. Babies have a limited capacity to cope with stress, and prolonged distress crying can lead to chronic stress. Overstimulation from crying bouts can also affect their ability to self soothe. Risk of colic. Some babies develop colic, which is characterized by excessive crying and fussiness for extended periods of time. This can have a negative impact on both your babies and your mental health. Attachment issues. If distress crying is constantly ignored or not responded to appropriately, it can lead to attachment issues in the long run. Babies may develop a sense of insecurity and mistrust in you. I'm not saying that you cannot let your baby cry. You can be mindful of how long they are crying for and also if their sound of cry changes. It's recommended that you don't let them cry alone for more than 10 to 20 minutes when putting them to sleep. Attachment issues refer to difficulties in forming healthy and secure emotional bonds or attachments with parents or caregivers during infancy and early childhood. These issues can have a long lasting effect on a child's emotional, social, and psychological development. These issues can stay in a baby's emotions until they are adults. Here's an explanation of attachment issues with examples to help someone who has never heard of it to understand. Attachment is a fundamental aspect of human development. It involves the emotional bond that a child forms with their primary caregiver, which usually begins during infancy. A secure attachment provides the child with a sense of safety and trust, allowing them to explore the world with confidence, knowing that their caregiver will be there when needed. However, attachment issues occur when this bond is disrupted or unhealthy, impacting the child's ability to form positive relationships and regulate their emotions. A few examples. Insecure attachment. One common example of attachment issues is insecure attachment, which can take different forms. Avoidant attachment. A child with avoidant attachment may seem indifferent to their caregiver's presence or absence. They may not seek comfort or attention from their caregiver, even when distressed. This can happen when caregivers are constantly unresponsive or dismissive of the child's needs. For instance, if a baby cries, but the caregiver constantly ignores their cries, the baby may develop an avoidant attachment. Anxious, ambivalent attachment. Hope I've pronounced that right. In this case, the child may display clinginess and anxiety even when the caregiver is present. They may be unsure of their caregiver's responsiveness, leading to a constant need for reassurance and attention. This can occur if the caregiver's responses are inconsistent, sometimes responsive and sometimes neglectful. Reactive attachment disorder, RAD. RAD is a severe form of attachment issues often seen in children who have experienced neglect or inconsistent caregiving in their early years, such as those in institutionalized care or adoption. Children who experience disruption in the early attachments. Children with RAD may struggle to trust and form bonds with caregivers and may display behaviours such as severe emotional withdrawal, a lack of eye contact, and a reluctance to be comforted. Disorganized attachment. Disorganized attachment is characterized by erratic and confused behavior in response to their caregiver. These children may display contradictory behaviors, such as approaching the caregiver for comfort and then suddenly pulling away or freezing. Disorganized attachment often arises in situations where the caregiver is a source of both comfort and fear, such as in abusive households. Impact on later relationships. Attachment issues during childhood can have long term consequences. For example, children with insecure attachment are more likely to have difficulty forming healthy relationships with peers and romantic partners in adolescence and adulthood. They may struggle with trust, intimacy, and emotional regulation. It is important to note that early intervention and therapeutic support can help children with attachment issues develop more secure attachments over time. Additionally, caregivers who understand attachment theory and provide consistent responsive care can help prevent these issues from arising in the first place or can facilitate healing for children who have already experienced attachment difficulties. It is important for you to respond to your distressed baby's cries promptly and with sensitivity. This helps in addressing the baby's immediate needs, reducing stress, and promoting healthy emotional and physical development. However, it is also crucial to recognize that babies cry for various reasons, including hunger, discomfort, fatigue, and emotional needs. Identifying and addressing the root cause of crying is essential for the well being of the baby and you. If you're struggling to cope with a consistently crying baby, seek support from a health visitor, GP, or parent resources. It's advisable to ensure the overall well being of you and your family. Disturbed or distressed. Disturbed or distressed sleep patterns in babies from 0 to 2 years can have significant effect on their feelings and emotions, physical health and mental health. Sleep plays a crucial role in the growth and development of infants, and disruptions to their sleep can lead to a range of consequences. Their feelings and emotions, irritability and fussiness. Babies who experience disrupted sleep patterns are often more irritable and fussy during their waking hours. Lack of sufficient rest can make them easily frustrated and upset. Emotional instability. Sleep is essential for emotional regulation in babies. When sleep is disturbed, babies may struggle to manage their emotions, leading to more frequent mood swings and outbursts. Separation anxiety. Poor sleep can contribute to separation anxiety in infants. They may become more clingy and distressed when separated from their primary caregivers due to a lack of restful sleep. Difficulty bonding. Sleep deprived babies and parents may have a harder time bonding because both parties are fatigued and less responsive to each other's emotional cues. Physical health, growth and development. Sleep is critical for the physical growth and development of babies. Disrupted sleep can potentially affect their weight gain and overall growth trajectory. The immune function. Adequate sleep supports a strong immune system. Babies with poor sleep may be more susceptible to illnesses and take longer to recover from illnesses. Nutrition. Sleep disruptions can impact feeding patterns. Some infants may eat less or more regularly when their sleep is disrupted, which can affect their nutritional intake. Risk of accidents. Sleep deprived parents may be more prone to accidents, which can indirectly affect the baby's safety and well being. Mental health. Cognitive development. Sufficient sleep is essential for cognitive development. Babies who do not get enough sleep may lag behind in their cognitive milestones, such as language acquisitions and problem solving skills. Behavioural problems. Chronic sleep deprivation in infants can contribute to long term behavioural problems such as attention issues and hyperactivity. Parental stress. When a baby's sleep is disrupted, it can lead to stress and exhaustion in parents. This, in turn, can affect the mental health of caregivers, potentially leading to postpartum depression or anxiety. Attachment and bonding. Inconsistent or disrupted sleep patterns can impact the parent child bonding process as both parents and babies may be more fatigued and less responsive to each other's emotional needs. Addressing and improving sleep patterns in babies is crucial for their overall well being. Parents and caregivers can work on established, healthy sleep routines, creating a conductive sleep environment, and seeking guidance from healthcare professionals or pediatricians if sleep issues persist. It's essential to recognise that sleep patterns can vary widely among infants, and some degree of disruption is common. However, consistent, severe sleep disturbances should be evaluated and addressed to support your baby's emotional, physical, and mental health as well as your own. Irritability patterns in babies from 0 to 2 can have various effects on their feelings and emotion, physical health, and mental health. It's important to understand that irritability in infants is a way they communicate their discomfort, their needs, or distress, and it can be caused by a range of factors. Here's a detailed breakdown of the effects. Feelings and emotions. Frustration. Irritable babies often experience frustration due to their inability to express their needs verbally. This frustration can manifest as crying, fussiness, or agitation. Anxiety and stress. Prolonged irritability can lead to increased stress and anxiety in infants. They may become overwhelmed by their own emotional state and the inability to soothe themselves. Dependence on caregivers. Irritable infants may become more dependent on their caregivers for comfort and reassurance. They seek comfort and security from their caregivers to alleviate their distress. Mood swings. Irritability can lead to mood swings in infants, causing them to go from content to upset rapidly. This can make it challenging for both the baby and the caregiver to maintain a stable emotional state. Physical health. Appetite and nutrition. Some irritable babies may have changes in their feeding patterns, leading to irregular or reduced feeding. This can affect their nutritional intake and growth. Sleep disturbances. Irritability can disrupt a baby's sleep pattern, leading to sleep deprivation. Poor sleep can have a cascading effect on physical health, impacting growth and their immune function. Weight gain. In severe cases of irritability, infants may not gain weight as expected due to decreased feeding and increased energy expenditure through crying and agitation. Increased risk of accidents. Caregivers of irritable babies may experience increased stress, which can affect their ability to provide a safe environment. This may increase the risk of accidents. Mental health. Developmental delays. Prolonged irritability can impact cognitive and emotional development in infants who are constantly irritable, may have delayed language development, and struggle with emotional regulation. Attachment issues. If a caregiver is unable to effectively soothe an irritable baby, it can potentially lead to attachment issues. The baby may not learn to trust that caregiver to meet their emotional needs. Caregiver stress. Your stress. Caring for an irritable child can be emotionally taxing for caregivers. Constant crying and fussiness can lead to parental stress, anxiety, and fatigue, which can affect the mental health of parents. Social development. Irritable babies may have difficulty engaging with others, both peers and caregivers, which can impact their social development. It's important for you to try to identify the underlying cause of your baby's irritability, such as hunger, discomfort, tiredness, or illness, and address those needs promptly. Additionally, creating a calm and soothing environment, establishing routines, and seeking guidance from healthcare professionals can help manage and reduce irritability patterns in infants. For persistent or severe irritability, it's advisable to consult with your GP or health visitor to rule out any underlying medical conditions and receive appropriate guidance and support. Early intervention and responsive caregiving can significantly impact the emotional, physical, and mental well being of your child. Changes in appetites. Okay, nearly done. I know this is a tough session. Changes in appetite in babies aged 0 to 2 years can have a significant effect on their feeding and emotions, physical health, and mental health. Appetite fluctuations in infants can occur for various reasons, including growth spurts, illness, teething, changes in feeding routines. Going to go through a wee detailed breakdown of the effects. Feelings and emotions, frustrations. Babies may become frustrated if they are hungry and their feeding needs are not met promptly. This frustration can manifest as fussiness, crying, or irritability. Anxiety, inconsistent feeding patterns, or changes in appetite can lead to anxiety in infants. They may become uncertain about when and how their needs will be met, which can contribute to emotional distress. Dependence on caregivers. Infants rely on their caregivers to provide them with nourishment. Changes in appetite can lead to increased dependence on caregivers for comfort and reassurance. Mood swings. Fluctuation in appetite can result in mood swings in infants, making them shift from content to upset quickly. This can affect their emotional stability and the overall atmosphere at home, their physical health. Nutrition. Changes in appetite can affect the nutritional intake of infants. If a baby is consistently not eating enough, they may not get the necessary nutrients for healthy growth and development. Weight gain, a prolonged decrease in appetite, can result in slower weight gain, which may be a concern for some infants, particularly those who are already struggling with growth issues. Energy levels. Infants need a steady supply of energy to support their growth and physical activities. Changes in appetite can lead to fluctuations in energy levels, affecting their overall physical health. Immune function. Adequate nutrition is essential for a strong immune system. Fluctuations in appetite can impact the baby's ability to fight off illness. Mental health. Developmental delays, sustained changes in appetite, especially if they result in inadequate nutrition, can potentially lead to developmental delays in areas like weight gain, physical milestones, and cognitive development. Behaviour issues. Infants with irregular or unpredictable feeding patterns may exhibit behavioural issues such as fussiness, irritability, or difficult self soothing. Attachment and bonding. Changes in appetite can impact the parent child bonding process, as caregivers may become more stressed when their baby's feeding patterns are inconsistent or when they refuse to eat. Parental stress. Parents of babies with fluctuating appetites may experience increased stress and worry about their child's health, which can in turn affect their own mental well-being. It's crucial for you to monitor your baby's feeding patterns and respond appropriately to their cues. Ensuring comfortable and nurturing feeding environment, offering a variety of age-appropriate foods. Seeking guidance from healthcare professionals can help manage changes in appetite. If there are persistent concerns about disturbed or distressed baby's appetite or growth, consulting with your pediatrician, GP, or health visitor is advisable to rule out any other underlying medical issues and receive tailored guidance and support. Early intervention and attentive care can help mitigate the potential negative effects of changes in appetite on an infant's feelings, physical health, and mental health. Now, the next section, we will be looking at solutions for this, so please don't be panicking. Go and grab a wee cuppa and then you can move on to the next section.